Thank you everyone for being here and a wonderful panel to talk about this very, very important issue. I think after the COVID years, we've all realized the importance of health and also having a very healthy government structure to help people in times of need. And climate change increasingly is also focusing more on health and the impact that the coming years and the vagaries of nature are going to have on health and disease. I think that has become one of the big focuses now. We did talk about how the Dettol Banega Swasth India campaign is a very popular campaign and a very big campaign that NDTV does. It started as a Banega Swasth India, cleanliness, but then we shifted it in the last couple of years. It's been a 10-year-long campaign. We've shifted it to Swasth because we realized sanitation and cleanliness, it's all contributing to health, and that really is what needs to be focused on today. So I'd like to start with Mr. Kant. And when we talk about what the future holds in terms of disease, health, sanitation, I think increasingly we're realizing also the impact that all these issues have on the poorest in our country, and that is something that at NDTV also we've been focusing on. So if you could, tell us, what do you feel are the, urgent things that need to be done to stem this or ensure that we have a healthier population?
So, Gargi, a lot of diseases arise out of uh, lack of toilets. They arise out of lack of proper sanitation. They arise because, incidentally, the stunting and wasting of and the level of malnutrition in India is very, very high. And I think, to my
Very
mind,
alarming.
one of our key priorities has to be in the field of nutrition. And this happens because uh, we've got into a very vicious cycle of a weak mother giving birth to a weak child. And the weak mother is because there's lack of sanitation at home, and there's lack of proper feeding, and our inability to track a pregnant woman from the point of her pregnancy through the period of the delivery of the child. And to my mind, a lot of this issue of stunting and wasting is can be solved with both sanitation and our ability to do tracking, digital tracking of the pregnant mother. To my mind, we've done very well in terms of creating close to about 110 million toilets in the last few years. 110 million toilets, that means that we've actually built toilets equivalent to the entire population of Germany. That is the population of Germany. That's the size and scale of what we've done in terms of hardware. But hardware is not everything. The software component of better usage of toilet, how to use toilets, cleaning of hands, the softer elements of that are, to my mind, very important. The second key issue, to my mind, is the issue of climate change, which will be very critical for a country like India. We've not accounted for the vast amount of carbon space that has been occupied by the developed world already. We occupy only 1.5% of the total carbon space available. But we will, in the coming years, become the third most polluting country in the world. And therefore, there is a challenge, and lack of a decarbonizing strategy will have a huge impact on the lives of citizens, as it is having in places like Delhi and Mumbai, because of the bad quality of air. And therefore, India needs to take up this challenge of becoming the first country in the world to industrialize without carbonizing itself, and therefore a huge strategy of decarbonizing. And this, to my mind, would require a three-pronged strategy, a huge movement of energy transition. That is, how do you convert a lot of biomass that is available without going through intermediate stages of briquettes, etc., straight conversion into energy. And that's a technological challenge which India has, taking biomass straight into energy and creating a nice a viable commercial economic model out of it. A second is, uh, to my mind, uh, urbanization in India is very unsustainable, which is impacting the life of citizens. There's lack of planned urbanization, which is uh, because you are making cities for cars and not for people. So cities have to be driven on the back of public transportation and not on cars. We are copying the Western model of urbanization, which was made for cars and not for people. And we are at a beginning stage of urbanization. We have only 25 cars per thousand people as compared to 1100 cars per thousand people in the United States and 950 cars per thousand people in Europe. So we can move straight into a public transport model without the huge legacy of the kind of, if US was to do it, Europe was to do it, there'll be huge cost to this. But India can leapfrog technologically in this. And third is my view that our urban areas, urban cities, and now increasingly in rural areas, there's a need for a huge uh, uh, extension mass communication on keeping areas clean. Even areas like Delhi, Mumbai are extremely dirty and filthy, and to my mind, huge focus in the mind of citizens on segregation of waste at household level is very, very important, because all this has an impact on both swachhata and swastha. So, at the household level, and that is why this whole mission of life, that is lifestyle for environment, of nudging people behavior. How do you nudge people and nudge people into behavioral change for a cleaner India is the most important thing to my mind, because nudging people towards and communities towards behavioral change is most critical for improving the lives of our citizens in the coming years.
Right, sir. No, absolutely. This change in mindset is something that's very important, and creating this cleanliness mindset among people. That's what our campaign Banega Swasth India is also about. Bringing about that change in people's mindset. As they said in my introduction, I've also covered the Ganga, and it's a river that we revere. I traveled all along the Ganga, and it's incredible that I have actually seen people throwing garbage on one side into the Ganga, and then on the other side, they're going and praying to it as well. So we revere the river as well, but we also throw a lot, and all our cities pollute the Ganga, and it's also a big source of disease as well, because of the all the drains, etc., from the cities and towns that are emptying into what is one of our most celebrated rivers. But Pariksith Singh, you have a lot you want to focus on. Away from sanitation, you have a lot of fears going into the future when it comes to health and the sort of technologies that we're all using.
Yeah, thank you, Gargi. It's a pleasure listening to you. But I think we have to think of the next version already, since technology is moving very fast. We are seeing the side effects of technology, and I think we are going to see them, or are already seeing them in India too. Our youngsters are using very powerful technology. 5G is nothing nowadays. We are thinking of moving to 6G. We are using smartphones, and our children are sleeping with these smartphones next to their chests, putting them on their chests, sleeping, girls are putting them in their bras. Babies are keeping them on their laptops, on their laps. And that is a lot of radiation. I think a lot of research needs to be done. And we are seeing impact of that. We are seeing young people with breast cancer. We are seeing brain tumors. We are seeing a lot of issues. Of course, it has to be properly documented and studied. But there is no reason to sleep with a cell phone sitting on your chest at night for 12 hours. I see no reason for it to be. When you're not using it, put it away. You're not sitting next to the microwave cooking and putting your head inside it while you're heating your food. So let's be a little more aware of it. make sure our children are not getting exposed at that tender age. We are seeing side effects of so much use of plastic. Girls are getting early menarche, which means early periods. They're getting developing tumors early because the estrogen levels go up. The side effects, obviously, of global warming, I mean, that's a huge problem. Vaccination, we are seeing a lot of challenges. Of course, it's controversial, but the challenge of vaccination, especially with mRNA, that has to be studied. We are seeing young people dying of pericarditis, cardiomyopathy, a lot of coagulopathies, which is, in English, it is your blood becomes thicker. Again, these things have to be studied. We have to move to a point where this impetus is freed up from politics, because it's for all of us. It's for the sake of all of our children. So lobbyists, big industry, we have to figure out a way to keep our policies away from that. Unless all of us become conscious and are aware of it, that education and that empowerment, and each of us understands it and concentrates on it, and with a concerted effort works towards maybe Swachh Bharat 2.0, which cannot happen without a Swachh mind and a Swachh heart, then this will be a huge challenge.
Do you feel you're being slightly alarmist, especially when it comes to vaccines? We're talking about health and we want our public to take those vaccines to protect them from disease, or is it just the new vaccines you're talking about?
Right. So again, all science is based on research.
Yes.
So we have to be able to, yes, it was needed. There was a pandemic of humongous proportions at that time, and I think India did reasonably well with the old styled vaccines. It was a smarter thing to do. I think it was very smart not to just use the new vaccines that have come in. Yes, they may be useful, but I think
at NDTV we did a lot of programs encouraging everyone to go out there and take that vaccine and protect themselves
that's okay.
against COVID.
But
yes.
see, science, this is science. So we have to be able to look at the good and the bad and the ugly. We are not all the same. Let's accept it. Each of us has a different physiology, different genetics, different chemistry. What would react? And suppose I know that this person would have a reaction to it, I may be prepared for it. Maybe they need a preventive medication. I need to be conscious towards it. We took care of so many COVID patients. So obviously I pushed for the vaccine. At that time there was no option. You had to try, we did everything. But now let's take a step back and study. The resistance to studying, the resistance to even consider that there is a side effect, that I think is unscientific. So let's have an open mind, because science is about being transparent, looking at the data. What if there's we did not know a few years ago that there was vitamin D deficiency galore everywhere.
Yes,
we did not know that there was a kind of cancer that can be treated with infusion of ascorbic acid, vitamin C. Now, 50 years ago, I would have been laughed off this stage if I had said this. Helicobacter causes a cancer of the stomach. It's a bacterium. Who thought ulcers are caused by a bacterium? The person who brought this out, later he won the Nobel Prize. When he brought it out, he was laughed off the stage. He was basically asked to leave the stage for even considering it. But that is what science is, and we have to have an open mind. I'm not saying I am right. I would never say that. But let's study these things, and so we know what are the grades and side effects.
All right. Well, let's now, talk again about, the poor in India and the need for better sanitation and health for them. As Mr. Kant said earlier, it's very true. Malnourishment is such a huge issue in India, especially among the poor. You have children who are actually 5 who look like 2-year-olds, and this is because of constant diarrhea, mother's health not being good. Again, it comes down to the disease that is being spread because of the poor sanitation, the dirty water that they have access to. With climate change, we're going to see more flooding, more droughts, and again, this is going to become a larger issue. So, Amita, if you could talk a bit about that. And when we talk of action, sir, it's the central government, then you have the state governments, then you have, the city, municipality. So at all levels, one needs to address this. And of course, we need civil society, which unfortunately in recent years, I'm sorry to say, but has been somewhat demonized or attacked as well. But they're a very important partner, as we saw during COVID, to help, be on the ground and deal one-on-one with the people who need help the most.
Sure. Going back, even the SDG goals, we will not be able to achieve them, whether it's 6 or 13, without civil society cooperation. So I'd like to just go back 2 centuries, if I may, when Chief Seattle told us, we do not weave the web of life, we are a strand. Teach kids that the earth is our mother. What befalls the mother befalls all of us. So the virus then taught us, I think, 2 years ago, how interconnected and fragile we are. Uh, have we learned any lessons is the question we must continue to ask each other. So Vandana Shiva reminded me last night. She said this blue dot you spoke about in the morning will be extinct if we did away with the green mantle it has. So we need our forests, we need our trees, we need our rivers, we need our biodiversity, and water as a fundamental right, both for the planet, and for people. So she also thought that tinkering around with environmental laws means we are cutting the branch we are sitting on. So let me begin with talking about access, accessibility, and equity. Uh, maybe I will look at the glass being half full. The Swatch campaign that you launched certainly, improved coverage. It brought attention to an important issue. It gave focus. It became a topic of conversation. For me, most importantly, it became aspirational. And I think, so heads up for infrastructure and for what was done. But can we then widen access, sustain the gains, verify the drainage issues? Are there interconnecting drains? Will the toilet work without it? Is there water? And the evidence on the ground. So as WaterAid says, is it adequate, appropriate to climate change and resilient? And is it also gender segregated, especially at our school levels, where you deal with menstruation and you lead with all of those issues? So the question is, do we sometimes shoot the messenger, as we did with the NHFS survey? We spoke about anemia being on the rise. We spoke about India's not fully defecation free. And I will tell you that I can give you evidence of that if you come with me on a night visit around the homeless shelters in Delhi. And these are people, 1% of our cities live on the streets. They sustain our cities. They're the rag pickers and the contract workers, the informal sector. So we need to ensure that those toilets run by DUSIP and other agencies provide adequate water and toilet facilities. So there is, of course, need for hostels. And you come from the Kerala cadre, where that's one of the few governments talking about housing for all. So where are the dormitories? Where are the workers as our cities and towns and urban centers grow? Where are the safe places for women to stay? These are aspects that we need to address. But coming back to the backbone of what is Swachhata, I think our two groups of people we must look at very closely, which were the manual scavengers. 96 deaths, as Bezwada Wilson to me last evening, in 2023. Can we move towards zero deaths, with political will? Can we also then look at waste pickers? And Chintan Bharati Chaturvedi told me that these are people who recycle 20% of our waste. Yes. And 50% of it is compostable, So can we give them social security? Very simple. And pensions. These are things, they work all their life to keep our cities clean. Can we also then appreciate our dissenters? I think these are people without consultancy contracts who tell us some hard truths. So instead of shooting the messenger, let's uphold the doctrine of public trust. And let's also then keenly listen to those 1,200 memos that came in on the Forest Rights Amendment Act, which really spoke about, are we cutting that branch we are sitting on? And these are serious issues, but I'll come back to some other points. So let's not miss the opportunities that you have created. Let's also look at the Anganwadis, the schools, the people with disabilities, menstrual hygiene, design, maybe redesign and retrofit for climate resilience, drought, as well as rains. And let's also look at the urban and rural context, those semi-urban growing areas, which are the booming towns now because of the highways. And let's look at the system-wide perspective, the entire supply chain, instead of working in these silos as we do often. And when it comes to CSR, let's also look at the business responsibility of companies, which also includes companies like Swachh Bharat and others can truly talk about respecting the planet. A lot of ads show that you wash your hands and then the chemicals, the surf comes up, and what does it do? So public messaging is important, and as you spoke about the phones. But I've got some more and I'll come back after.
Right. Well, we are short on time, but shooting the messenger. Now, you have civil society groups that are somewhat critical and are under attack right now. In the last couple of years, we have seen they're systematically targeted. Messengers, also the media, and I think the media, unfortunately, in the last couple of years is more wary of doing reports or covering issues that are critical of the powers that be. But this is a very important factor in ensuring that we, tread the right path. If Anganwadi workers are unhappy and they come onto the streets, I find very little coverage of it. We at NDTV do try to cover these issues. If NGO is raising something regarding public health, very few channels actually cover these issues. So, Mr. Kant, if you could just comment on this about how NGOs are also partners in this, and the media's role is also so important to draw attention to, where government is lacking, where authorities are lacking, and where improvements are required.
So the madam has raised a number of very relevant and valid points, and throughout the COVID period, I was heading the committee which worked with civil society organizations, and let me tell you that I worked with almost 80,000 civil society organizations during the COVID period on a vast range of areas. I asked the state governments to work with all the civil society organizations, and if India achieved success during the COVID period, civil society organizations played a very positive and constructive role. And it's not that India
well,
does not
I'm so glad
play.
to hear you say that, because it's very true and it has not been as recognized.
And
as
let
it
me
should
tell
be.
you that aspirational district program we covered 115 of the most backward districts of India. We don't call them backward, we call them the aspirational district program. On improving learning outcomes, and improving health outcomes, and improving nutritional outcomes. I had almost about 100 odd civil society organizations working with me in various rural areas, and they all did a very positive and constructive job of doing. Some of them did really outstanding, remarkable job. So to say that we are condemning every civil society organization is both incorrect and unfair. There are a lot of very positive and constructive civil society organizations who work in partnership with us and deliver good. In my career, all my life in government, I've always worked with civil society organizations, and I've always had a very fruitful and constructive partnership with civil society organizations. And if I have achieved success in my career, it's because of my partnership with civil society organizations. But to say that every civil society organizations, because I ran the Darpan portal in Niti Aayog, I also know that how many of them are well functional, how many of them are good functioning, constructive, positive civil society organizations, and several of them are defunct and do not perform. So I am speaking for all those who are really believe in transforming India, and it will always be a pleasure for us to work in partnership.
I mean, I'm so glad you said that, and the role that they played during the COVID years. But once COVID was over, then again, all these issues of, FCRA, etc. And somehow in the mind of the public, I find, especially on social media, which is like a very messy place, there's this sort of distrust. It's foreign funded NGOs that are, have some nefarious sort of aims. But Amita, what would you like to respond to that?
So just before we came in, I was showing Amitabh a report that we brought out, which was released here in 2023, which speaks about civil society's contribution to the nation at 75. It talks about a 2% at very conservative estimates of contribution to the GDP. We are some of the highest employers of people. We do yeoman service to communities, and every innovation worth its salt, be it to the right to information, be it to the ASHA workers, the midday meal program with Care India, all of them came from civil society, and government took it to scale. So that That is the kind of partnership that one is expecting. Of course, there may be
And
a...
thanks to officers
yeah,
like Mr. Kant
exactly.
in the past who worked, as he said, in partnership with them.
And even in this hygiene space, you have the work right here in Rajasthan of Dr. Vivek Agarwal, who works on food redistribution of food that's left over. And I've just been hearing so much about his work. He actually recycles food waste. So, he ensures it goes to the hungry. He has a 24/7 helpline, and he has people working round the clock. And he's quite a, hero for a lot of people. People have worked on, Navdanya works on biodiversity, Rajendra Singh on water, the Safai Karmachari Andolan, Beswada Wilson work is completely exemplary. So we really need to, probably collaborate more with NGOs and civil society. We need to not be top down and look at controlling and harassment and setting agencies upon. There are enough laws to deal with whatever errant agencies are there. We also need to ensure that the mental health part of our discourse is also taken care of. So maybe we should strive to ensure that there is less negativity in public discourse, that there is less hate speech, all of them, which, on a daily basis, it affects me and my children. So I think it's time that we looked at all these issues as being terribly important. And there are some initiatives that the governments have also done.
Sure.
For instance, we were asked to give some solutions. Tamil Nadu did the rainwater harvesting and said every building would not get its license if it didn't. I was in Chennai when the corporation head was ensuring that every waste picker would wear their uniforms. Odisha has a Garima scheme for the manual scavengers. Gujarat has a heat action plan which could be replicated given rising temperatures and climate change. Karnataka treats its wastewater and diverts it into construction and the metro. So a reduction on the dependency on fresh water. So I can go on and on.
Countless issues,
there's
yes.
countless, as much as there are non-profits working in this space. So these have together holding up the sky in a sense.
Right,
Yeah.
absolutely. The panel discussion is now over, but open now to the audience to ask questions. Yes, ma'am, do we have a mic? Yes.
On one hand, we are having apps as toilet seva, where we can find a toilet near us. But most of the times there is no water, there is nothing. So we are saying that the use of sanitary pads should be reduced, and it should be shifted to menstrual cups or tampons. But there is no enough facility available with that toilet seva thing. There is nobody.
Right, so we have the technology, but as you said,
yeah,
like
the
a lot of
technology is in
toilets don't
place,
work.
but it's not working on
All
the
right.
root level.
Let's get one or two more questions as well, and then we'll take them. Yes, here, this boy in front.
Hello, sir. Good to see you. So my question is, given the circumstances, I'm talking about the climate change issue, by the way. So
Can you speak up a little bit?
yeah,
Louder.
can you hear me now?
Yes.
So given the distortions that are around all through and through East and West, we don't seem to, the country doesn't seem to have a strong footing in terms of the transition that we are going to have. The reason I'm saying is coming from an oil and gas background, the environment is very volatile. But are we actually keeping the lid on this prices, and the transition doesn't seem to be like palpable? The way Europe is kind of having a Europe is kind of having a
transition.
yeah,
in
the
country.
Europe
Are
is
we
having
going
kind
to
of a carbon taxing
Are we going
environment.
to manage what we're
Are
aiming
we?
for?
Yeah.
Yes.
I hope
So-
you understand my question.
Yeah. So let me respond to this issue of energy transition. It's an important issue. So India has, while we've not occupied a major component of the carbon space, we've occupied 1.5% of the carbon space, whereas on a per capita basis we should have been entitled to 17.5%. But irrespective of that, India has done a lot for energy transition. We've done about 185 gigawatt of renewable. But even if we do 100% of our electricity as renewable, that will be only 20% of the energy. the balance 80% of the energy is all hard to abate sectors like steel, cement, refinery, long distance transport, where we use imported fossil fuel, which is, we import worth about 200 billion worth of fossil fuel. The country is planning to use green hydrogen, that is, use renewable energy, crack water, and then produce green hydrogen and use it to replace fossil fuel. And our aim is that by 2047, by the time India becomes 100, we should actually be an exporter of energy rather than an importer of energy.
All right. Well,
And that will be all clean energy.
I hope. So that, yes, the gentleman there. Yes.
One of the main causes of the climate change is the human being. So we should address the population control. And number two, I see more meat eaters than 50 years ago when I was here. So I think the cattle also is contributing. So we should address these causes.
Who would like to take that? Amita?
Very valid points, and those are things that I would, being a physician, I wouldn't deal with it, but these are completely valid points. We should avoid too much meat in our diets, especially
for the sake of health as well.
for our own health,
Balance.
and we should try. You can get enough protein from vegetarian food. They're great athletes. You can be very healthy with a very balanced diet, and there's no problem with that. Problem is, it has become also a status symbol, and we need to, again, a concerted effort from all of us, being aware of everything we do, looking at our actions and the impact they have.
But
as a
even
society.
I think the amount of dairy we consume, I mean, it just ensures that we have lots of cows and lots of gaushalas, which also contribute to some of the heating as well. Well, yes. This lady in front. Oh, yes, go ahead.
This is a question for Mr. Kant.
I'll take two questions, yes.
Mr. Kant, my name is Lieutenant Colonel Rahul Srivastava. I was working with the Army for 20 years, Corps of Engineers. During the Uttarakhand disaster, when it happened, so I connected Badrinath, and we had a lot of labor, coming from the state of Jharkhand, who are working with border roads. Now I work in the private sector, setting up factories. We talked about, unplanned urban development, and the lady talked about, the health, the sanitation workers. See, we all work on L1 concept in government sector, sir. On first hand, we don't have a development plan, I must say, for the nation. At the same time, we want to work on the most cost-effective mechanism. And when it comes to that, I suppose that's a kind of controversy or a mismatch. Because if we really want to give the facilities to the most worker, then we need to cater for that in the master plan for the country. So do you have any thoughts about it? How are we going to get a balance in this?
Okay, just one more question. Yes, the lady.
Yeah. So yesterday, Mr. Kant, you mentioned India has leapfrogged into the digital era much faster than many other large countries have. How does that save trees in terms of, have any studies been made on how much paper we've actually saved? And secondly, we have the advantage of a lot of solar energy in this part of the world. Why is that so undertapped? And what do you think we can do to actually then replace unhealthy energy sources with the sun, solar energy?
So let me start with the question there. And I don't think we need a master plan for the whole country. As India is too large a country. We are bigger than 24 countries of Europe. What you need is a master plan for every statutory town and every city. And that should be a well-planned citizen participative urbanization plan, which is critical so that urban areas grow on the back of public transportation, because transportation is a very major contributor to CO2 emission. And you need planning for that, and that is a job of states. Every state must do it for every statutory town. I'm a great believer. And secondly, you talked about L1. The government doesn't say that you do L1 for everything. The financial rules say that you should follow a transparent, competitive process. You can do 80% cost, 20% quality. You can do 80% quality, 20% cost. I've never done L1 in my life. I've always believed in working with the best. So I believe in working with the best and most civil servants should follow that process of going through a transparent process, competitive process of doing that. But not necessarily L1. The question here was about digital leapfrogging. I was talking yesterday in the concept of digital leapfrogging for Aadhaar, for bank accounts, for fast payments, for credit, for financial inclusion, for insurance, for stock broking, etc. I was saying how we are using the power of digitization. And let me also say that on the energy side, actually, India is one of the few countries which has the climatic condition. The only other country which has a similar climatic condition is Saudi. So we should really push for the renewables. We've done that in a big way, but now we are pushing for solar rooftop. The Prime Minister has announced the new Surya Uday scheme so that we are able to have every housetop with solar rooftop. And secondly, as I said, it's not, even if you were to do solar, it will be just 20% of the energy. The hard to abate sector, cleaning them up is very important. And that is what we are pushing for in all these areas. India is the only country which has a smart grid. We have the only country which has one grid across the country. So a lot of digitization in the grid has been done, which many of you do not realize, but it's no country in the world has one grid across the country which India has. Thank you.